ado, I will hand it over to Christine.
Thank you so much, Tristan. Thank you guys for coming. As she said, my name is Christine, and I was actually very happy when it was Cheryl that approached me to do this talk. And it was very exciting because I hadn't had like too many opportunities to speak with so when I speak, it's usually to other nurses. But I appreciate the opportunity to speak to like the aerospace community always. So the topic that I wanted to talk about today was essentially how we can collaborate and be a team. And I know that women in aerospace medicine has a lot of specialties, but a lot of it is physicians and residents. So I wanted to talk to you guys today about creating that like collaborative team to mirror what we have on Earth, essentially a interdisciplinary bridge. So you already did a great job of talking about me, so I'm going to go ahead and skip that, skip that one. Um, and so we'll get right into it. Um, as far as nurses in aerospace goes, I think the first person that you will think about when we talk about nurses is Dee O'Hara. So she was one of the first nurses, the most famous nurse, I would say, when it comes to aerospace medicine. One of her big contributions is that she didn't just like help, she actually built a trusting bond with a lot of the astronauts. One of the big things was that the flight crew and the astronauts kind of knew how to get around and what to say to the psychologists and the physicians to not be able to get like their wings taken from them, what they used to call clipping their wings. So essentially, if you said the wrong thing or if you divulged too much of your medical information, you wouldn't be able to fly. But Dee actually built a bond of trust with them. So essentially, she said, "Look, guys, you guys trust me. Um, as long you can tell me anything that's going on with you, and I'll help you. And as long as it doesn't endanger you or the mission, I won't essentially say anything." And so it worked out in that the astronauts trusted her to the point where some of them would say, nobody could take my blood but Dee. So she kind of proved that the the nursing theory of seeing the patient as a whole person um actually works in space medicine. So as we go further and further out, um, you know, uh, going from the moon to Mars and hopefully interplanetary one day, the shift will occur from short duration missions, as you guys know, in low Earth orbit, where you can get out of there in just like a few hours, to, having these multi-year missions to deep space where evacuation isn't even an option. Um, and at the very least, communication with Earth will take, half an hour to an hour to the point where decisions have to be made at the time. So when we're changing that, it's going to start require uh, a clinician that is more focused on like chronic health management. Okay, so just like I said, up to 20 minutes delay each way when we're talking about Mars. So it because of that, it's either we're going to do the mission or we're not going to do the mission, that go, no go decision. So essentially you're gonna need somebody, some kind of a crew medical officer that's able to do an autonomous decision making without being able to reach Earth. So right now, the way that we have it is, the flight surgeon, he does the diagnosis, he or she, excuse me, diagnoses the pathology, translates what the engineer says, And then the engineer kind of builds the systems and focuses on the constraints. But there's that like middle area of, taking care of the astronaut who can run the daily operations. At this point, the flight surgeon is doing the daily operations, but is that really like something that where the doctor should be focusing his or her attention, right? It's kind of not really the scope of the doctor to be having to worry on day-to-day operation stuff. Going back, there is a proof of concept of a team called the Winged Angels in World War II. Essentially, they did a lot of the medical evacuations. As you can see, the sheer amount of soldiers that they evacuated. And compared to the amount of soldiers that they evacuated, they had very little deaths. Um, and at this time, there were literally no physicians on the airplane, which means that they had like complete autonomy. And so they just kind of cared for the soldiers the way that they knew how. Coming into like more modern times, the United States Air Force does employ a squadron of aeromedical nurse practitioners. And essentially they are the ones that do like the daily operations, they do the readiness exams. Um, if a situation does arise where the flight surgeon has to go somewhere else, they can jump in and serve as a substitute for the flight surgeon. They also work on like the investigation boards for situations that happens. There is a Major Jessica Nizel. She's the consultant to the Surgeon General, and she actually is one of the first aeromedical space nurse practitioners. So, I don't know if many of you had heard of this. There was a period of time where I actually wanted to join CCAT. But the critical care air transport team in the military um, are the ones that evacuate the sick patients. And they are operating in high noise, high vibration environments, usually in some kind of a aircraft or some kind of rotor wing. And they are, because of that, they're in confined spaces. They don't have, all of the medical supplies that we usually have in the hospital at their fingertips, and they are able to titrate medications. They are able to take care of pretty much any machine that the patient is attached to. And they're the ones that are actually with the patient, managing them at all times on transport. And so the patients that they're taking, are very sick patients. The CCAT nurses are taking the patients that are, the TBI patients, the ones that have the head injuries. They've gotten into, like explosive injuries, those kind of things. So they're managing really critically ill patients. Another example that I have of extreme autonomy is Major Katie Lunning. So she actually was the first nurse to win the Flying Cross. And she was under fire, uh, and she was able to get 22 patients out of that area in Kabul. And when the standard patient load for a flight nurse is three, she was able to take care of 22. And I think when I was reading that article, she was able to take care of an infant as well. And she was able to do a transfusion of blood in another patient, which essentially um, I've done before in the ICU. That's like a one-to-one patient where it's like one nurse with one patient doing that. So that's actually like a big achievement of hers. She really deserved that flying cross. So I had some military examples, but it's not just the military. These are some pictures of nurses taking care of patients in like high autonomy situations. So this top right picture is CRNA. So there are nurse anesthetists where that's a highly specialized nursing field where we are able to administer anesthesia and help the anesthesiologist. This bottom right picture here, this is actually Kathy DiBiase. So she is a NASA, um, what's the word I'm looking for? She's in the NASA Hall of Fame for all of her contributions to the space program. She's not in the military, but this is a flight suit that she's wearing. And she's actually showing the astronauts how to put their suit on and take it off. Um, this bottom left picture here is a nurse in the trauma bay. And the trauma bay is actually a very high stress situation because these patients are coming in straight from the accident that they came from, that they were at. So imagine somebody getting into a car accident, the paramedics pick them up, they stabilize or they try to stabilize them and they take them to the hospital and they are received by the trauma bay. And in this situation, we help the doctors, we give blood, we take x-rays, imaging, and we send them to the OR or interventional radiology or up to the trauma ICU, whatever they need. But essentially, the trauma bay is where they go to get stabilized first. And then this top left picture, this lady right here in the middle, this is my badass boss right here. She is a flight nurse and paramedic, and she works for the Trauma Hawk, uh, which is the flight ambulance here where I live in West Palm Beach. One day that will be me. So this picture here in the middle is actually just how sick our patients can be. So nurses are actually in charge of handling and monitoring all of these drips, all of these medications that the patients are getting. This machine here, I don't want to insult anybody's intelligence, but for anybody that doesn't know, this is the continuous dialysis machine, so CRRT. There are patients that are too sick to handle hemodialysis for 4 hours, so they have to get like constant, continuous, like low hemodialysis. So that's this machine. The nurse is actually in charge of monitoring this and keeping track of it. Um, Back here, there's a machine called the flow track, which keeps track of the um, internal pressures of the patient, actually, for like to kind of like explain it lightly. So we are the ones that monitor this and we are keeping in contact with the doctor to decide what to do to keep these numbers normal. And I'm pretty sure somewhere in there, probably on the other side of the room, is the ventilator. Somebody that's on all these things is probably on the ventilator. So just kind of to show you the kind of things that that nurses can do. On top of being the a medical person for the whole patient, nurses can actually be scientists. So I have two examples here. This is Dr. Aubrey Florum Smith. Um, I actually just met her last month and she's really nice. She's actually a nurse scientist and she was researching VR for psychosocial prevention. And I know that psychosocial is going to be a pretty big thing with having to deal with isolation in long-term space flight. So I know AI is they want to do a lot of AI to kind of look at astronauts' faces and notice like micro changes to see if they're getting depressed. Um, and so she's doing some of the VR work there. And then Dr. Alyssa Shannon, who is a nurse practitioner over here on the right-hand side, she was actually chosen to be the crew science officer on the Chapea mission. Am I saying it right? Chapea. So that is one of the big NASA analogs. So she's doing that. So on top of being, medical, we also can serve as scientists. Inside nursing, there isn't much of a like inside mm, in schools and what we're being taught there isn't too much of a push into nurse scientists, but as you pass like the bachelor's level there is a big push for nursing innovation, where nurses are actually helping create the machines and the tools, and even inventing them themselves. So, at the higher levels of nursing, there is a big push for nurses to be actual like scientists. So, um, wanted to also just talk about how we are always going to be a team. So there are things that the physician does well, the nurse does well, and there's things that we do together. So where the physician does like the diagnostics, the complex diagnostics, like surgery, the diagnosing pathology and those kind of things, the nurse is more focused on, the patient's well-being, where we kind of take care of like the long-term stuff. We support them psychosocially, and we make sure that the protocols that the physician implements are being taken care of. And then together we take care of them acutely, and we make sure that everybody's safe. And so this slide is just kind of to talk about how in long-term space flight, a lot of the things that we're going to have to monitor are like nursing processes, things that nurses already do. So, for example, in the ICU, nurses are in charge of monitoring strict I's and O's, we call them. So that's intake and output. So all the fluids and food that you intake, and then all the fluids and solid waste that you output. A strict intake and output would be very good in managing the intracranial pressure increases and like the puffy face, so like the fluid shifts that occur in space travel. Another thing that's not on here um, is kind of like monitoring like radiation. So out in space, you're taking in a lot more radiation, and there's like dosimeters that they're saying that we're going to have to wear like at all times. So one of those things that the nurse could monitor is like the amount of radiation intake, on top of the other things where we will detect and help with space adaptation syndrome. So that's when the astronaut goes up to space and they get nauseous, essentially. Um, um, and also, there's an aspect of space adaptation issues where uh, patients, or not patients, where astronauts will kind of get disoriented, and it's a not only a physical thing but also a psychosocial thing. So these are the kind of things that we could pay attention to, on top of the unglamorous, like, and I know that there's a lot of like sample gathering. So nurses can also, in the hospital we do that a lot, where we will gather samples for tests. We take blood, we send urine, we send stool. So we can also do those things. So essentially, the new squad goals that we're thinking about is, you'll have your high-ranking commander, that's in charge of the actual mission. You'll have the flight surgeon on the other side, that is the one that creates the protocols, and then we'll have the space nurse that bridges those two things. Um, Also in here is should be the engineers that are in charge of the actual like machines and mechanics. Um, and the nurse is kind of like the bridge between all of those things. Okay, so how can, women in aerospace medicine as well as other organizations kind of help, include nurses? We can advocate for roles. We can ask for them. We can ask for nurses. I mean, if everybody wants nurses, then we will have to train them. So that will make more trainings and fellowships for nurses, because a lot of the fellowships right now are for uh I mean, and rightly so, because we're in this like kind of like short, lower Earth orbit phase. But now is a good time to start training the nurses so that when we need them, they'll be ready. We can have more funding for nurse-led investigations, and Penn University is actually doing a lot of nursing innovation-led funding. Um, and also we can promote the dyad. So within your organizations that you work with, you could be like, on Earth we have physician nurse teams. Why not in space? So as we go further, it's not so much, the run and gun solitary pilot. It's going to be like an interdisciplinary team that keeps everybody safe. All right. That was really short, but thank you very much. You can reach me at Christine at thespacenurse.com if you want to like collaborate or anything like that. Thank you again to the Women in Aerospace Medicine for letting me do this talk. And you guys can go to my website, thespacenurse.com, where I kind of go a little bit more into how nurses can help in future space. So that's it.
Perfect. Thank you so much. That was incredible. Let me go ahead and stop the record.